So, up till now, we have discussed briefly, to summarize, we have discussed the theoretical introduction of preclinical sciences, how it will be done, where it will be done, what is the syllabus, what is the physical place of teaching, who are the teachers that will be required, what is the pattern of teaching, synchronous teaching of medical subjects, how many years will be required, 2 years, monthly test, unit test, weekly test, and at the end of the 11th and 12th standard, there will be university examination and the students will come out. They will take NEET examination, NEET UG as we would call it, clear, and things seem very, very rosy, but the viewers, I am aware, want to ask 5 critical questions. These questions are displayed on the screen. I request the viewers to kindly have a look. This entire curriculum has been proposed based on the assumption that after 10th standard, every student has made up his or her mind to join MBBS. Who are you to assume that after 10th standard, the student has already made up his mind to join MBBS? Who are you to assume? Is MERC not being assumptive and presumptive? The present curriculum of a PCBZ, Physics, Chemistry, Botany, has been introduced as an introductory course. This introductory course in 11th and 12th will give him or her a feel whether he or she would like to join medicine or allied group of degrees. That is the reason why PCBZ has been introduced. How do you answer this question? There are thousands of students who want to pursue alternative medicine, that is Ayurvedic, Unani, Homeopathy and Siddha, and lakhs of students who want to pursue nursing and allied group of degrees. Is MERC not MBBS centric? Is MERC not just going on focusing on MBBS? A question that is being proposed by the entire medical community, rather more than the students, it is the parents who are proposing this question, and that is the rising costs of medical education in India. How does MERC plan to offer a solution to the rising cost of medical education in India? A couple of years ago, the government has very appreciably introduced what is known as the competency-based medical education, also known as CBME program, which has been blended or fused into the MBBS program. What it is, we will come to later. The question that viewers, especially from the medical fraternity, would like to ask is, how does MERC, how does this plan to fuse CBME, how does it plan to amalgamate CBME into MERC? What is the alternate pathway for a student who does not secure a MBBS seat at all, despite 1 or 2 attempts or 2 or 3 attempts, but still wants to pursue medicine? So, these 5 questions are extremely critical. Unless we answer these questions, we cannot go forward. So, we would like to answer these questions one by one. It has been assumed by MERC that students immediately after 10th would have already decided to join medicine. Who are you to assume this? That is the question. There was a time when there was high school, middle school, high school, that is 10th standard, fail in 10th standard for 7 times, then do 11th and 12th standard, fail 5 times, and then join what is known as LMP. At that time, there was only degree that was present, licentiate in medical practitioner. There was no MBBS. And there fail enough number of times, half a dozen times, and finally come out as LMP. Later, when we move towards the 60s, etc., again failed in 10th standard 5 times, fail in 12th standard, 11th and 12th 3-4 times, and then join BSc, CBZ, that is chemistry, botany, zoology, failed 2-3 years, and then join MBBS and leisurely do MBBS and come out at the age of some 30-35 years. We then move to the 70s and 80s, where the 11th and 12th standard marks were being considered as the yardstick or the benchmark to join MBBS. This system came into effect. When it came to the late 80s, that is where I came from the late 80s. I entered MBBS in 1988. It was somewhere in the beginning of 1982-83. In those years, the system of entrance examinations, All India Medical Entrance Examination, that was introduced. So, students began to prepare in their 12th standard. As we moved ahead, students began to prepare in 11th standard, courtesy tutorials, coaching classes. As we moved to the 90s and 2000s, Foundation MBBS was started in 9th and 10th standard. Today, it is not an exaggeration. These are not stories. I am quoting from what I have read. Students are preparing from their 6th and 7th standard to enter IIT. And students right from 8th standard are preparing to join MBBS. Therefore, let us not try to put a stamp forcibly upon our students. These are our next generation students. These are our latest generation students. They are much more brilliant, much more prepared, much more aware than all of us. They are ahead of our times. They are not waiting. Neither are they going to wait up till the last day of 12th standard examination is over. Right from 8th standard, they are aware of what the quantum of competitions. They are aware of the intensity of the competition. They are aware that a thorough, long, detailed, diligent preparation is required. So they are studying right from 8th standard, and it would not be an exaggeration, and I hope the viewers will agree with me that I am not wrong if I say that students have decided right at 8th or 9th or 10th standard that they have wished to join MBBS or any other group of subjects. So it is not the case that they are an undecided category or they are lost in the woods or something like that. No. MERC is very confident that this generation students have already decided on what they want to do. Having said that, the question is taken and the question will be respected. And it is, there would be, let us assume, a certain segment of the so-called undecided category, as I would like to say. So they have not yet decided that whether they want to join or not. What is going to happen to them? Nothing is going to happen. The viewers, I request the viewers not to make the erroneous assumption that the introduction of anatomy, physiology, biochemistry, community medicine as preclinical sciences means that PCBZ will be scrapped out. No, the introduction of APBC or preclinical sciences does not automatically mean that physics, chemistry, botany, zoology, PCBZ will be totally removed, deleted as scrapped. That is never the idea of MERC. PCBZ is a time-honored group of subjects. It will continue forever. It is always there. There are thousands and lakhs of students who want to pursue pure sciences. PCBZ will always be there. Whether we want it or not, as we just discussed, as we had just mentioned, suppose, let us say, God willing, this preclinical science program is approved. Do you mean to say that tomorrow there will be 1,000 colleges all across India, from Kashmir to Kanyakumari and west to east, there will be colleges all over within one day? No. I envisage as an individual, and I envision that perhaps there will be 5 colleges. I mean, I'll be happy as a person, as an individual, and I'm sure everybody else will be happy if there are a huge mushroom growth of colleges of preclinical sciences, if approved, God willing, which would come up. We'll be very happy. But then let us take a very moderate estimate. There will be not more than 5 colleges to begin with, which would perhaps offer these new curriculum, preclinical science curriculum, if introduced, if accepted by the government. That is always the bottom line. 11th and 12th standard. So what happens to the rest of the 23.5 lakh students or whatever it is? They will continue in physics, chemistry, botany, zoology. These few hundreds of students or few, I would say 100 students, let us say, few hundred students who have studied anatomy, physiology, biochemistry, new curriculum, they will write an entrance and come, enter MBBS. The rest of the 23.5 lakh, whatever it is, 23 lakhs, 499, whatever it is, they all will come through same physics, chemistry, botany, zoology route. Until what time? Until that point of time when all over India, every student of the 11th and 12th standard who wishes to join MBBS/allied group of degrees, until he or she has unhindered, easy access and availability to join College of Preclinical Sciences at every district or taluk level, until they are established, physics, chemistry, botany, zoology will continue to be there, and all the students will write the same entrance examination, PCBZ, and enter MBBS. So, all doubts, I hope the viewers have no doubts. So, let us say for 23.5 lakh, for let us say 25 lakh students, we would require thousands and thousands of preclinical science colleges if approved, if established. It will take nothing less than, we will be very happy if it happens within 1 year. But then, let us be realistic. It may take 1 year, 2 year, 3 year, 4 year, 5 years, or maybe 6 years, 7 years. We don't know. Until then, definitely there will be a group of students who will be entering MBBS from PCBZ stream. There will be students who will be entering from APBZ, APBC new curriculum stream. Immediately one question will be asked, will there not be an educational disparity? These people would already have studied 2 years of first MBBS portion. These people would not have to have, which then nothing will happen. The sky is not going to fall on our head. What will happen? What is happening today? The same thing will happen. And that is, today, 25 lakh students are studying PCBZ and entering MBBS. They are studying for 1 year and learning anatomy, physiology, biochemistry. Same thing will happen. Only thing is, a few students who have been lucky enough to have exposure, they will know a little bit more than those students for 1 year. But then that so-called advantage will be there only for 1 year. When they enter second year, everybody will be on an even platform. Everybody will have the same educational first year MBBS platform. A few may get some gold medals more, a few may get gold medals less, but that is okay. So, and last question that needs to be answered is about this so-called introductory course, about that undecided category. Because viewers will continue to say that no, there will be people who have undecided. What do you have to do? They need an introductory course, they need a feeling course. As I have already mentioned, if you want to know whether you are interested in joining MBBS or not, what better subjects can there be than human anatomy, physiology, biochemistry and community medicine to know whether you have an interest or not? Study medicine subjects. You will automatically know whether you are interested or not. Why do you want to study physics, chemistry, botany, zoology? To know whether you have an interest in medicine or not. This is the answer to all the three questions. MERC is being MBBS centric. There are students who want to join Ayurvedic, Unani and alternative group of medicine, BSc, allied nursing. It has already been explained very clearly that MERC's proposal of preclinical sciences is not MBBS centric. The preclinical science subjects provide a common foundation for everybody so that there will be a form of an inclusive education. Everybody will have the same foundation. From there onwards, they can branch off. How does MERC address the rising costs of medical education in India? As an introduction, it is well known that after 12th standard, students write the entrance examination, they gain entrance into the colleges. I'm not here to discuss about private college, government college, semi-private, semi-government, that, this and all that. Whatever it is, no matter what it is an expensive process. Some of them don't get it. Their entry is through capitation fee. I'm not here to discuss all those things. The question here is, we need to understand the core philosophy behind this problem. Once the student enters the medical college, merit seat, semi-merit, all these we are not discussing. He or she has to pay the fees as prescribed by the college. There is no argument about this. Immediately they will say that the government undoubtedly is doing a lot of things in this. The government is coming up with a huge number of medical colleges. The government is trying to cap the fees. So many things are being done, but I'm sure the viewers will understand that the government will have certain limitations, meaning that the government just cannot order a medical college. Let us say there is a private medical college. They are charging some amount of fees. The government cannot just say that you stop charging the fees. You charge only this much of fees. It cannot do so. The private colleges will go to court. If I am not mistaken, they have already gone to court. This will become a legal battle. It will drag on and on. Let us assume that the government wins the case. Let us say the government wins and says that there is a limit, cut-off limit on the fees. What will the medical colleges do? Private medical colleges, they will say we cannot run the medical college. Who will be the sufferers? The students will be the sufferers. You can bring in a law saying that the fee structure cannot be increased, but you cannot prevent a person from closing a medical college. The person says, no, I'm not able to run the medical college based on the fee structure that you have proposed. Therefore, I'll close the medical college. It is my medical college, I will close it. Therefore, on one hand, we cannot have a situation where the government can say that they will strongly come by way of the legal route or the governmental route. On the other hand, we cannot just say that let the students suffer, let them go on paying lakhs and lakhs of rupees. No, we cannot have. We have to have a via media. We have to have a middle pathway. What is the middle pathway that MERC wishes to propose? The more the number of years the student spends in the medical college, the greater will be the fee that the student has to pay. In other words, first year, second year, third year, 4.5 years. If the student spends 4.5 years, let us say it is 1 lakh per year, the student will have to pay 4.5 lakhs rupees. There is no, this is simple, straightforward mathematics. So what is the solution? What if the MBBS course duration itself is reduced without compromising quality, without compromising academics, without compromising education? What if the MBBS course duration is reduced? Meaning that for 2 years, a student has been prepared for preclinical science. Extrapolating the same philosophy to paraclinical sciences or the second year MBBS subject, that is human pathology, human microbiology, human pharmacology, and forensic medicine and toxicology. These are the 4 subjects of second year MBBS. If the second year MBBS subjects, just like the first year MBBS subjects, can be taught in an extra medical college environment, that is, in an environment outside the medical college, then before the student enters MBBS, he or she would have, for all practical purposes, completed first year MBBS, second year MBBS. Only 2.5 years of MBBS will be the course strategy behind reducing the cost of rising education is to decrease the number of years spent inside MBBS, inside a medical college, or to put it across in another way, to reduce the MBBS course duration to 2.5 years without compromising quality, without compromising education, at the same time, with no exaggeration, enhancing the standard, enhancing the quality of education before joining MBBS. It is to introduce the course of Paraclinical Sciences after 12th standard for a period of 2 years in which human pathology, pharmacology, microbiology and forensic medicine will be taught in what would theoretically be known as what MERC feels should be known as College of Paraclinical Sciences. So, the establishment of Paraclinical Sciences group of colleges will lead to once again a drastic drop in the fee structure. So, on your screens there is a theoretical fee structure wherein the preclinical sciences for first and second year they will be charged, let us assume 20,000 to 50,000, that is the range, and same for paraclinical sciences, 20,000 to 50,000 will be the range. So the mathematics is there in front of you. So the entire preclinical and paraclinical sciences would be completed within a fee structure of anywhere ranging from 80,000 rupees to maximum of 2 lakhs rupees. And what about the quality of education? The quality of education would be doubled, if not more than that. Why? The same reason. The same paraclinical sciences, namely the all-important subject of human pathology, human pharmacology and microbiology. Today, again, with due respect to the policy makers, the second year MBBS curriculum has been reduced to 1 year. Pathology and pharmacology is being taught within 365 days and the student is being pushed into the clinical arena or the clinical setting. What is the fallout of this? What is happening because of this? The students, after having hurriedly going through foundation preclinical, namely APBC, and within 1 year having completed pathology, pharmacology, microbiology and toxicology, even before they have completed and acquired, as I said, absorbed, assimilated and understood these subjects, they are being thrust into the clinical area, clinical hospital for clinical exposure and patient interaction. Not to forget, the present policymakers have also introduced the so-called system of adopting a family by the students. That is, students go to some areas, rural areas or semi-urban areas, semi-rural areas, and they adopt a family and interact with all this in the hope of fast-tracking medicine. The strategy is to fast-track medicine. The philosophy is correct, but then if you try to fast-track a particular academic program without an adequate academic, scientific, organized foundation, what will be the result? The result is that these so-called little clinicians, as we would call them, they would come out with sketchy, tattered, half-baked knowledge of these extremely important, all-important foundation subjects and paraclinical subjects, and they would just be lost in the woods, that they will not even know how to interact with patients, how to solve the case. Ultimately, what is MBBS all about? What are you preparing the students for? To crack the case. Patient has a problem. Patient has a disease. You have to break down. You have to break down those symptoms, signs. For all this, you need a huge amount of foundation, diligent teaching. And for that, what do you need? You need time. You can't cram, you can't shrink 2 year academic program into 1 year and fast track and saying that we'll teach some important things. As I said, the disease does not read the textbook and come. The patient is not going to tailor his disease according to the need, according to the quantum of knowledge of the students. The students have to tailor the quantum of knowledge according to the disease, according to the problem what the patient has. Therefore, the introduction of 2-year paraclinical sciences in post 12th standard would drastically reduce the rising expensive costs of medical education, massive foundation of these pre and paraclinical sciences would be laid out. Leisure teaching of these most important subjects, especially human pathology. Once human pathology is nothing but the subject which deals with the disease process of a human being. What is wrong with the human being? What is the disease process? Once that is learned, it's as good as medicine is learned. And pharmacology, naturally, that is the treatment. So, these foundation subjects, when they are taught for 2 long years with adequate clinical exposure, the student would enter MBBS with a completely pre-prepared knowledge with a super strong foundation, as I often repeat. And this is how MERC plans to tackle the rising costs of education. I repeat, in summary, recognize those subjects which can be effectively taught in an outside medical college environment, extra medical college environment. And this is how we go about this. Preclinical and paraclinical sciences put together would ultimately, MERC feels that this would effectively be, collectively be, these 4 years would be known as pre-medical sciences. Preclinical and paraclinical together would be known as 4-year pre-medical integrated course, 4-year PMIC, as displayed on your screens. And this is what MERC envisions this to be the future of medical education prior to joining MBBS.